Okay, so I have my markings. Again, this is the area that I want to aim the tip of my needle to. That's where I am planning on my third foramen, my S3 to be, and this is where I'm actually going to numb the patient up. So Diana, I am going to numb you. I'm going to use some local anesthetic, okay? And it will sting for a moment, but I promise it will numb fast. I'm going to start on the opposite end of where I'm standing so that I'm not working over my my needle and my wire, my lead. So Diana, there's going to be a little poke here, okay? And I want to create a wheel. So what I do is I keep my bevel towards the skin as superficial as I can, and I kind of flood that area. And with practice, I promise your wheel will improve. Oops. Okay. Then what I want to do is I want to numb deeper. So what I'm going to do is I'm going to place that needle straight in, and I want to remember that there is a bone plate there, and I want to go ahead and when I touch that bone plate, I want to come back a little so that I don't inadvertently numb up the third foramen, that opening and the nerve that is near there. How you doing, Diana?
Pretty good.
Yes, you are. Okay. So I'm ready with more anesthetic in case she's going to need that, and Diana's going to let me know if she needs more. This is the 3.5-inch needle. You'll see that there are centimeter markings on this needle. There's an area up here that is non-insulated right at the hub of the needle, and that is the area that once I find placement in S3, I'm going to take the test stimulation cable and I'm going to release that hook and hook it up to that non-insulated area, and that will allow us to test for stimulation. So we're going to get started here, Diana. I want to enter at a 60-degree angle and aim the tip of my needle towards that third foramen. I'm going to go ahead and get the needle in, and then I'm going to have to reposition, and I'll talk about repositioning once So I hit bone plate, and Diana's doing great. What I'm going to do now is I'm going to start walking down the plate. Instead of left to right or lateral to medial, I'm going to walk down the plate and drop into the foramen. So what I want to do now is I'm going to have Brent hook up turn the Verify on. I'm going to have Diana tell me when she feels the stimulation. I'm going to pull back just a little so I'm not resting on her skin. So Diana, do you feel any pressure, tingling, vibration, warmth? Patients describe it in many ways. Are you feeling anything?
No.
Okay. What are we at?
170.
Okay, I'm going to go ahead and I'm going to take the test stimulation cable off, and then we're going to turn that back to 0 so they don't ever inadvertently give Diana a little more stimulation than is necessary. I'm going to go ahead and I'm going to reposition the needle. I'm going to stand it up at a little sharper angle here, and I'm going to go ahead and I'm going to move my needle down, and I'm going to, sorry Diana, let me give you a little more numbing here. So you can also use the needle, take the stylet out, and you can introduce more local anesthetic using the needle when your patient indicates that they may need that. And then I'll go ahead and I'll place my stylet back in. And I'm going to march along. So we're off, yes. I'm going to go ahead and hook the test stimulation cable up, and we're going to go up again slowly, very slowly, and you tell me if you feel warmth, vibration, humming, tapping. You're going to take the test stimulation cable off, and I want to tell you you're doing a great job. I'm finished with that side. I'm comfortable. I didn't see a motor response. That would typically be what we call a bellows, where there would be some lifting and lowering in this perineal area. I did not see motor. I don't think we got toe. We did not get toe, but I'm very comfortable with her sensory response. So we're going to go ahead and leave that needle there, and I'm going to numb up the other side, Diana, okay? You're doing great. There's going to be a little bit of a poke here. Okay, good for you. Good for you. And I'm going to work on this wheel here. So I'm just numbing the superficial area here, and it works quickly. And then I'll get a little more and numb deeper. And I'm going to go ahead and find the bone plate. I have this needle placed on Diana's left side, and that gives me a very good gauge for my needle that I'm going to place on the right side here. So I'm going to try to mirror or mimic that entry point. And the first thing I want to do, though, is I want to make sure, typically there's 4 centimeters between the two foramens, the 2S3 on each side. So I just want to confirm that I'm in that area and that I haven't repositioned my needle on the left side to change those measurements. So I'm comfortable with that. I'm going to go ahead and I'm going to You all set?
I guess.
Okay. I'm going to go ahead and I'm going to hook the test stimulation cable. And Diana, we are going up very slow, 1/10 at a time, changing the stimulation. So the moment you feel something, you let me know. Where do you feel that?
I think more or less near my vagina.
Okay. So again, I didn't see a motor response, and of course motor response is ideal, but her sensory response is, I'm satisfied with that. Typically in the office setting, it's not uncommon to not see a motor response. Motor response comes when patients are very relaxed, and this kind of setting, it's a little more difficult for the whole body to be relaxed. So it's not uncommon to not see a motor response, but her sensory and where she feels it and the settings, the stimulation setting, makes me very comfortable that we're in the right place.